The title of our project is Determination of Potential of Drug Candidates to Cause Severe Skin Disorder Using Computational Modeling. We will be referring Stevens-Johnson syndrome to SJS for simplicity's sake. Now we will be presenting about the background information of SJS. It is a rare yet life-threatening form of adverse drug reaction, and very little information is available on drugs that cause it. It has no cure, resulting in high death rates of patients suffering from this adverse drug reaction. Symptoms of it include fever, severe rashes, and epidermal detachment, as seen in this picture. In our project, prediction model is created using one-class support vector machine. We chose this as less time, cost, and resources is required, and it has been practiced for a large range of projects.
Next, we will move on to the methodology of our project. The picture below shows the software RapidMiner, which we use most frequently during our model construction process. When we input relevant data about the drugs into the operators, it will be able to help us churn out results for easier analysis during evaluation. Below is a detailed breakdown of our methodology. First, we will collect chemical information of the drugs which we are investigating on through Chemical Database MicroMedex 2.0 and the Drug Information Handbook. After identifying 200 SJS positive and negative drugs each, we further divide these two sets of drugs randomly in the ratio 8:2 into modeling and validation set. Following that is a series of normalization process which helps us scale down the descriptors of these drugs, which are essentially numbers describing their chemical properties into comparable range for model construction. After that, we further split the modeling set into 5 subsets, 4 of which will be used as training sets, providing the model with information of what properties contribute to an SJS positive drug, while the remaining set will be used as testing set to evaluate the performance of model after each round. All subsets will rotate in their roles as testing and training sets to reduce experimental error, and this process is called One-Class Support Vector Machine, OCSVM. Mean model performance is then taken after each round, and this cycle will be repeated a few times. Following that, we will select the top few performing models from these mean performances and combine them into a consensus model containing important attributes of an SJS positive drug. This model will then predict if the drugs in the validation set are SJS positive or not, and from there, we will derive the performance of this model, which is presented in the next table showing our model accuracy.
This table shows the results of 2 sets of data which we have collected, one for the modeling set and one for the validation set. The unhighlighted section shows the total number of drugs identified in our experiment. This data will contribute to the sensitivity and specificity value of our model. These values, highlighted in the red portion, contribute to the calculation of our MCC value. MCC is the Matthews correlation coefficient value, which is a way to evaluate a model's performance. The higher the MCC value, the better the model is. This MCC value contributed to our model accuracy, which is approximately 66%. SJS is a very complex disease with multiple mechanisms. Thus, the current set of chemical descriptors might not be able to identify true negatives accurately. Second, prediction models were combined using consensus modeling methods. Thus, it may not be as accurate as compared to binary classification. Third, a set of very stringent criteria for SJS negative drugs in our study. Drugs have to be in the market for more than 30 years and must be used to treat common diseases. This restricts many drugs that fulfill the former criteria but are not used commonly as they are used as second or third line treatment. Next, we will move on to the areas of improvement. Further studies could improve the consensus model by using a larger set of chemical descriptors and using all the available descriptors to develop the prediction models. This can increase the accuracy of the model. In conclusion, SJS is a very complex disease with multiple mechanisms, and thus a 66% accuracy in our results is highly encouraging. Second, OCSVM and consensus modeling methods have a lot of potential in being useful tools for facilitating the prediction of different types of rare but serious ADRs in the early stages of drug development. Further research and fine-tuning of modeling methods can further enhance accuracy of our model.
Lastly, we would like to thank the NUS Department of Pharmacy and our mentors, Dr. Yap Cheng Wei and Ms. He Yu. Also, we would like to thank the MOE Digital Education Branch for providing us with this rare opportunity. We would also like to thank our teacher mentor, Mr. Chao Ban Ho, for his guidance. Thank you.